like to say thank you for invitation, for giving us opportunity to present results of our work here, and we will proceed. Our topic is interdisciplinary approach in orthodontic treatment with speech therapy as a key to stable results. It was made by me. My name is Alina, and my colleague, her name is Natalia. She has also joined our presentation. So let's start. I'm doctor. I'm orthodontist, candidate of medical sciences, and I run my private practice since 2014, but in fact I'm the patient of speech therapist since I don't remember when, from my childhood, because sometimes I think that I think more faster than I can speak. So I hope this will not interrupt today's presentation. And my colleague, Natalia, she is, I hope, the photo is not you can see her beauty on this photo. She is a candidate of pedagogical sciences and associate professor of the Department of Special and Inclusive Education in our Boris Hrynchenko Kyiv University, Ukraine. She has more than 27 years of experience in speech therapy, and I'm very proud to work with her. It's our university, and enjoy. It's our beautiful capital, Kyiv. Our students.
Sorry, should we hear the voice? Because I cannot hear anything. I see a slideshow, but I cannot hear anything.
It's music. I think I'm not speaking.
Okay, so just to let you know that we probably cannot hear anything.
1 moment. Okay. It's our students. It's our beautiful students. It's the way we work now.
So these are the patients or the students?
It's some of the moments of our lessons, of lectures, of practical readings, and this is how we live in today's situation. We don't have silent nights since February 24th, 2022. It's Kyiv. It's in the middle of the night.
Since February 24th,
and
2022.
We see people crying on the streets. We can see bomb explosions from our homes. We hear people screaming, but we keep living, we keep fighting, and to all the soldiers, all the heroes that defend, all our warriors who defend Ukraine from Russians. It's very important for our country, so it's the thing that I wanted to start with. But now let's get to our clinical case. One moment. So it's my patient. All of everyone you will see here are my patients. It's Lisa. She is 17-year-old. She came for me for orthodontic treatment. But what I see here, and what do I teach my students? I teach them to determine the root cause of the changes that can happen, that can lead to malocclusions. I show them how to identify the circle of changes and how to search where the reason is and where the consequence is. I show them how to use and when to use the golden growth periods that help us to achieve stable result, because orthodontic treatment is not about the number of appliances you have in your mouth. It's not about the number of years you cannot say something because you have braces, retainers, wires, appliances, bioblocks, all these face masks, extra and intraoral appliances. No, the orthodontic treatment is about how to achieve stable results and how to keep this result after you finish wearing all the things that you have in your mouth. So it's a 70-year-old patient, and you can see her here. And what can we see? We can see mouth breathing posture. We can see distortion in lip seal, especially on the right, this side photo. We can see overbite and overjet. So her upper incisors doesn't contact with lower incisors at all. At this fact, the main question that can be is how she bites. I don't know how she chews. Yes, with her side teeth. It's superimposition of what we have, what we see in when we don't look inner. It's normally, what do we need to look at? With normally in normal children without malocclusions, we can see no activity, any activity by swallowing except the region of the neck and under the tongue. But look at this child. She keeps swallowing like this from the, I guess, about 7-year-old when she started to have mixed dentition. But every time she swallows, she uses all the muscles of her face to make it. It's from the inside. Just take a look how strong her mentalis muscles are, how her cheeks are moving, how the tongue finds something to start, somewhere to start, from what point to start her swallowing movements. And it's in the mouth. Look, her teeth, frontal teeth, they have no contact at all, but still they are grinded. How? Every time she swallows, and it's 1 time per minute when she sleeps, and about 2 times per minute when she is not sleeping. So it's about 2,000 times a day she swallows, and she keeps working with her muscles to make her malocclusion more stable, stable, and stable, and stable. And that will not help me to make her perfect smile. I show my students and I tell them how to know what's inside the mouth before the patient is opening the mouth. Because we can read the face if we know where to look at. Our eyes do not see what our brain doesn't know. So knowledge is power. Look, she is not contacting with her upper and lower incisors when the jaws are together, but still they are grinded. How come how can this be? This is overjet. It's the place where the lower lip and the tongue meet every time this girl starts swallowing. And this function, it leads to narrowing of the upper and lower jaw. And the question is, why do the lower teeth grind it if they do not contact? And here is an answer. Look, at the left side, she is trying to pronounce the sound S. Every time she pronounces the sound S, her incisal edges of the upper and lower incisors meet, and it's the only way how she can grind her teeth. It means that if I do not work on her pronunciation, on her speaking habits, on the way how she pronounces her sounds, my treatment can be not so effective, as when it ends, and not so stable. F and V. The difference is that you can see here incisor edges of the upper incisors. It's not okay. It means that these teeth are in protrusion, so they are labially tipped. It means that if we say these sounds, every time the lower lip meets and comes in between the upper and lower jaw, and it is not helping me to close this overjet. The recommended treatment plan for this child is speech therapy, and I'm proud that it was made and it is proceeding with the first year program graduate of the program for orthodontists that was developed by Natalія Babich and me as a doctor for helping the speech therapist to interact right on time with orthodontists to get most effective results and to be the most beneficial for the patient. Then we added daytime and nighttime wear of habit corrector. It's orthodontic appliance that is that has my functional therapy built in its construction, and it helps me to overcome this improper swallowing and make the proper tongue posture that will help to keep the width of the upper jaw and stability of the nasal breathing and lip seal after finishing treatment. Then, after follow-up and eliminating of muscle mentalis activity, we will start orthodontic treatment. It's my child. She's interested what's here. And what we have and what we made new. The new thing is that we integrated the sleep questionnaire for the children with sleep disordered breathing, and all the children that have mouth breathing, that have malocclusions, they have sleep disordered breathing. And sometimes the orthodontist and the speech therapist are the first people who can point on this to parents and who can say that this sleep disordered breathing, mouth breathing, malocclusion, and speech distortions are very high correlated. And I'm proud that our department with Natalія Bабich, she adopted the speech assessment that you see the second page of this questionnaire. She adopted speech assessment from English language to Ukrainian language, and we are the first in the world with it. So, after 4 months of active speech therapy, my functional treatment, look at the changes of the lower third of the face of this child. If we couldn't see any activity of masseter muscles in the very beginning, after the 4 months, so she started treatment in August 2023, look after 4 months what changes in face proportions we have. Look at the smile and the lower third of the face. And here is the profile. You can see the changes in soft tissue, and the next slide I will show how can we look at it. Changes in soft tissues profile. Look at the lips. It's only 4 months. And here, the tongue posture. And the special consequence, firstly, lip seal, then tongue posture, rest position in the rest, and then in swallowing. And only in this sequence, and if you do it with orthodontic appliances, you can do it simultaneously. It helps me to work on stability of the result even before I put any orthodontic appliance in the mouth of the patient. So first, for the 2 months, soft tissue changes in lips. Next, changes are in tongue posture. Look at the swallowing. Before, look at the muscles activity. You can see cheek muscles activity, then mentalis activity, depressor of the angulus of lower lip activity, and on the second video, almost nothing. It means that the compliance of the patient and its responsible attitude to treatment plays big role in how we achieve the result and how fast and how stable, how predictable our results are. It's in the mouse. Here is what we see now. We see no activity of the lower lip and the mentalis when when the patient started swallowing. It doesn't mean that I put any orthodontic appliance in except the one that I showed you before. But I will not start my orthodontic treatment with fixed appliances before I can get mentalis not active, because otherwise it will push the lower incisors lingually and the correction will be not stable. But look at the improvement of the soft tissue profile. Look at the improvement of the mentalis. You can see, and you can't see any activity here, and it's only 4 months. And to be continued. But if we speak about our work, what happens if this girl, Lisa, come to us 10 years before? We could catch her on this stage. And before she reaches her 15, she would have perfect dentition, perfect harmonious face, perfect smile, no overbite and overjet, and no lifetime retention. And what happens if this girl comes to us, Lisa, come to us 4 years before she came? We would also give her perfect smile, perfect growth, harmonious face, no overjet and no overbite, and perfect growth changes. And in this case, working with my functional component is strictly and very important. And the main thing is to do everything on the right time. So we would like to tell that our students, they have opportunity to learn how to see the upcoming changes and upcoming distortions and the influence of on malocclusion formation before even the patient has mixed dentition or even permanent dentition. So I'm happy to work where I work. I'm happy to do what I do. I love what I do, and I love to give my knowledge to my students. So if you have any further questions, you can forward them to our emails, or maybe you can have, if you have some questions now, you can ask us. Thank you for your attention, and glory to Ukraine.
Thank you very much. It was very interesting and helping us to understand the role of speech therapy in this orthodontic treatment. It's really something
Yes.
amazing to see
I
those
hope,
results in 4 months.
I
Right?
stopped.
Great job. Thank you very much. Thank you all for being here, staying here. We now opening the question and answer